Hi everybody, this is Diane Geyer from Tidewater Lactation Consultancy located in Chesapeake, Virginia. Today's topic is stop watching TikTok. Stop watching getting your medical advice, your parenting advice, your breastfeeding advice from TikTok. Now, I realize that some of you might be on TikTok right now, so as long as you're watching my TikTok, it's okay. But you need to stop that. I have patients coming in all the time with bizarre things that they've learned on TikTok that are just not true or not the best thing for the mother and baby. Bad advice, sometimes dangerous advice. For example, babies, or not babies, but the people around the baby after you have a baby do not need a DTaP or Tdap vaccine. I had someone else telling me that she was not allowed to kiss her new grandbaby for a year. That was the rule. She could hold it, but she wasn't no kissing whatsoever. I mean, that's terrible. And that was gotten off TikTok. So please stop that. If you want information about medical things, then do your own research. Listen to medical people. If you want information about parenting, ask people who are good parents, maybe in your family, maybe your own parents, your own mother, if possible. If not, just look around and figure out good parenting. Get a good parenting book. And also for breastfeeding, please get breastfeeding advice from a board-certified lactation consultant or a good breastfeeding class, which they're very often not in the hospitals because they have to spout the hospital policy, which might not be best for you. There's an excellent breastfeeding book. It's the best one on the market, in my opinion, called The Womanly Art of Breastfeeding by La Leche League. They are responsible for the resurgence of breastfeeding in the United States, and they created the lactation consultant. Or take my breastfeeding class for $39, and I do them virtually if you like. But please, take a good class, if you can, that does not promote bottle feeding and which bottles to pick. That's not what you need help with. You need help with getting breastfeeding started for the first few weeks. Most breastfeeding classes are the opposite. Okay, so off my soapbox for a moment. And as I've started to do, I'm showing some of the artwork that I have in my office, and I want to show you this, which comes from Europe. My very first pediatrician, Dr. Saul Cohen, back in New Jersey, pediatrician for my first two children. We used to have a lot of discussions about breastfeeding because it was not very prevalent back then. And when I first went to him, he said, all my breastfeeding patients, they have to be given a multivitamin, a liquid multivitamin to the baby. So I started doing that. And then I went to La Leche League meetings and I found that La Leche League said breast milk is a complete food. Complete. They're not deficient in multivitamins or in any vitamins or in anything actually. So I told him about that and he said, you bring that to me in writing from La Leche League. He said, and I'll stop recommending that my breastfeeding patients give these vitamin drops. Mind you, his formula patients did not have to give the drops, just the breastfeeding patients. Just shows you how things have changed over the years. And I brought him The Womanly Art of Breastfeeding, not this one that I showed you, but a previous edition. And he said, okay, I'm going to stop telling them that. Anyway, he went on a trip to Europe, and the next time I went in for a visit, he gave me this, which really, really touched me. So thank you, Dr. Saul Cohen from Westfield, New Jersey. And thank you for tuning in for Tidewater Lactation Consultancy.